You are welcome to my channel. Thanks for visiting. Thanks for subscribing to my channel, but if you haven't subscribed, please kindly do that right now. Today, the topic will be BACTRIM or SEPTRA, that is trimethoprim with sulfamethoxazole, two medications combined under the name COTRIMOXAZOLE. These medications could come under different brand names, could be BACTRIM, SEPTRA or SEPTRIN, BACTRIM DS, that is double strength, SULFATRIM pediatric, Apple SULFATRIM, Protrain DF, Tevatrimel DS, or SULFATRIM DS. It belongs to the class of medications known as sulfonamide derivative antibiotic. The strength. I've decided to bring the strength of this medication out because we are single strength and double strength. Under the single strength, that is going to come with sulfamethoxazole, that is SMX, 400 mg, and trimethoprim, TMP, 80 mg. While the double strength will be sulfamethoxazole twice the dose of the single strength. So instead of 400 mg, it will be 800, and trimethoprim instead of 80 mg will be 160. So single strength, double strength. Forms can be in form of solution for intravenous use. In that case, we can have sulfamethoxazole 400 mg with trimethoprim 80 mg combined in 5 ml intravenously. Could come in form of suspension for per oral usage, like SULFATRIM pediatric oral, 200 mg to 40 mg per 5 ml, meaning 200 mg sulfamethoxazole and 40 mg trimethoprim. And it could be sulfamethoxazole trimethoprim oral, 200 to 40 mg per ml. It could be in form of tablet per oral use, like BACTRIM DS, and that will come with sulfamethoxazole 800 mg and trimethoprim 160 mg. That is double strength. While single strength would be 400 to 80 mg, and double strength again as 800 to 160 mg. Dosing. Single strength could be given per oral every 12 hours or 24 hours, while double strength could also be given per oral every 12 hours or 24 hours. Okay, for intravenous route, we will make use of the level of trimethoprim component to determine the dose per day as intravenous 8 to 20 mg per kilogram per day of the trimethoprim component of the COTRIMOXAZOLE. Then we will divide whatever the total daily dose is into 2 to 4 divided doses. So don't be confused. I have an example right here. Okay, so the example here is that if 10 mg per kilogram per day of trimethoprim is prescribed to be given intravenously to a 70 kilogram man, then our total daily dosing will be 700 mg of trimethoprim. Okay, then we will give that, if we are going for 2 divided doses, as 350 mg of trimethoprim intravenously every 12 hours. But if we are going for 4 divided doses, we will go for 175 mg of trimethoprim intravenously every 6 hours. Now uses. In urinary tract infection, acute otitis media, chronic obstructive pulmonary disease with acute exacerbation, in traveler's diarrhea, in pneumocystic jirovecii pneumonia, formerly known as pneumocystic carinii pneumonia in HIV, a bite wound, either human or animal bite, for both prophylaxis and treatment, in diabetic mellitus foot infection, epididymitis, in granuloma inguinale, in brain abscess, In osteomyelitis, still on uses, this is a pretty great one, that is methicillin-resistant Staphylococcus aureus. So when we are dealing with that, we can just go for our BACTRIM or SEPTRA or SEPTRIN. That would be great. Also in meningitis, spontaneous bacterial peritonitis, peritonitis generally, prostatitis, prosthetic joint infection, in septic arthritis, Q fever, in prophylaxis in HIV positive patient against Toxoplasma gondii or encephalitis, in melioidosis and shigellosis. Adverse reactions. There might be Coccidioides difficile, that is Clostridium difficile infection or CDIF. There's likelihood of hepatotoxicity, anemia, leukopenia, thrombocytopenia, agranulocytosis, or hyperkalemia. Also part of adverse reactions will include hypoglycemia, hyponatremia, tinnitus, cholestatic jaundice, and prolonged QT syndrome. Here, let me lay more emphasis. With prolonged QT syndrome, if there is no correction on time, there might be torsade de pointes. Torsade de pointes can degenerate to monomorphic ventricular tachycardia. Monomorphic ventricular tachycardia can degenerate to polymorphic ventricular tachycardia. Without correction, it can go down the hill to ventricular fibrillation. Without defibrillation, we may run into asystole. Without instituting advanced cardiac support, calling code blue on time, asystole may lead to death, and the patient will end up in the morgue. Still on adverse reactions, there might be hypersensitivity reactions, which may be immediate or delayed. While in medical school, I've seen that, and in practice, I've also seen that. So immediate hypersensitivity reaction could be anaphylaxis, urticaria, or angioedema. While delayed hypersensitivity reaction could be Stevens-Johnson syndrome, toxic epidermal necrolysis, dress is not to wear a cloth, it's drug reaction with eosinophilia and systemic symptoms syndrome. There might be erythema multiforme and generalized acute enzymatic pustulosis. Still on adverse reactions, the individual could come down with nephrotoxicity when used with cyclosporin, TTP, thrombotic thrombocytopenia purpura, and respiratory system will not be spared because it could now lead to pulmonary infiltrates, and the individual will start coughing and become dyspneic. Contraindications. When we come across any of these, we will not give this medication. Number 1, hypersensitivity to sulfur drops, then hypersensitivity to trimethoprim, hypersensitivity to any component of the formulation of this medication, anyone with history of thrombocytopenia in the past as a result of the use of sulfamethoxazole and trimethoprim or sulfonamide, or any infants less than 2 months old, we will not give this medication in all these situations. Also, we will not give this medication in all these situations. 1, severe renal disease, then severe hepatic damage, megaloblastic anemia secondary to folate deficiency, blood dyscrasias, pregnancy or breastfeeding. We will not give this medication under these situations. Still on contraindications, premature infants, acute porphyria, we must delay pregnancy till 1 month after the use of this medication. And if we must use this medication in pregnancy, it should be for the shortest time and not towards delivery. You will know why in a bit. Now, drug-drug interaction. please contact your pharmacist or your clinical pharmacologist who will be able to guide you appropriately. You know what? In medicine, it's collaborative. No one is an island. No one can fix it all. No. That is why I've been giving some section of this presentation to some of my colleagues in pharmaceutical industry. I mean, the pharmacists and clinical pharmacologists. Monitoring. We can monitor using complete blood count, potassium level, remember hyperkalemia, right? Calcium, sodium, blood urea nitrogen, creatinine, liver function test, thyroid function test. Mechanism of action. Trimethoprim will inhibit the hydrofolic acid reduction to tetrahydrofolate, and that will result in sequential inhibition of enzymes of the folic acid pathway. Sulfamethoxazole, on the other hand, will interfere with bacterial folic acid synthesis and growth through inhibition of the hydrofolic acid from PABA, that is para-aminobenzoic acid. Warnings. I'll start with the horrible one, that is fatality is possible with the use of this medication from agranulocytosis, aplastic anemia, if not corrected on time. Also from hypersensitivity that could lead to toxic epidermal necrolysis or Stevens-Johnson syndrome. Like I said earlier, I have seen this happening. Okay, I've seen this happening while in the medical school and also in practice. Most of the people don't know that they could die from this medication. Now, the awareness is coming out more and more, right? Also, severe liver damage could lead to fatal hepatotoxicity. Hyperkalemia, you know the effect on the heart, right? Hypoglycemia, you know what that could cause in minutes. And also hyponatremia. Still on warnings, avoid this medication if there's history of allergy to SEPTRA or sulfasalazine or Lasix. Okay, Lasix is furosemide, right? Someone is asking me, what's the business? The person is just having hypersensitivity or allergy to Lasix, the medication to just pee frequently, water medication or whatever you call it. Yes, don't be upset. There is that possibility that anyone with hypersensitivity to Lasix will have the same effect with BACTRIM or SEPTRA or SEPTRIM. Note that. Probability of cross-reactivity can occur with loop diuretics, which Lasix is one, thiazide or oral hypoglycemic like filling the gap. Be cautious with impaired liver. I've just said fatal hepatotoxicity is possible, kidney, thyroid gland problem, and respiratory tract problem. Still on warnings, be careful in asthmatic patients, and don't use this medication with leucovorin. In anyone with HIV that is being treated for pneumocystic jirovecin pneumonia or like that, there may be treatment failure, and don't use this in neonates because you can teach them to kernicterus. There can be hyperbilirubinemia. Warnings. There must be extreme caution in people with AIDS, acquired immunodeficiency syndrome, G6PD deficiency, folate deficiency, porphyria, or slow acetylators. Examples of where and when we can use BACTRIM or SEPTRIM or SEPTRA will be in type 1 for either prophylaxis or treatment. Here we can use BACTRIM double strength, 1 tablet twice daily, plus metronidazole for 5 days. But if there's infection already, then extend the days to 14 days. Other examples will include HIV with pneumocystic jirovecin pneumonia, or formerly known as pneumocystic rhinine pneumonia with toxoplasmosis. In that case, we can go for per oral double strength 1 tab once daily, or single strength 1 tab once daily, or double strength 1 tab 3 times weekly. In osteomyelitis secondary to methicillin resistance Staphylococcus aureus, you can go for 4 mg per kilogram intravenously or per oral every 12 hours, but add rifampin to that. The last example will be a meningitis secondary to methicillin resistant Staphylococcus aureus or Listeria monocytogenes or Escherichia coli. In that case, you can go for 5 mg per kilogram per dose every 6 hours or 8 hours or 12 hours, depending on severity or the protocol at the center. With that, I've come to the end of this presentation. COTRIMOXAZOLE, that is combination of sulfamethoxazole and trimethoprim, is a pretty good drug with broad spectrum, but be careful. In a bid to help the patient, you may actually harm. So proper history, particularly what's happening to the liver, to the kidney, the glucose level, then hypersensitivity reaction to even laxatives, that is not an antibiotic, to several drugs generally. Thanks for listening. Remember to share this. Remember to subscribe to my channel. I appreciate it.